Hi everyone, Dr. Timothy Gallagher here.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, today I thought we'd talk about, treatment options for shoulder and elbow. So as the weather starts to get nice, people are out there doing more activities, including spring sports and yard work. People are starting to come in flared up with shoulder and elbow pain. So we're going to talk to you about treatment options for the shoulder and elbow. Stay tuned. Okay, Dr. Mike, as we introduced, a lot of patients are coming in with pain in the shoulder or pain in the elbow. How can we help at Maragal Medical treat these conditions?
There's so many things we think about. First, once we do get that diagnosis, we kind of exclude this, the referred problem coming down from the neck and things. Now we're looking at first acute issues. Acute inflammatory things, we're going to bring out our laser, we're going to bring out our trigger point injections, we're going to calm the muscle tightness down, these knots that all develop, and then we're going to try to reduce the inflammation. I might need to use a short course, maybe 5 days of an ibuprofen, just to get things settled down. And then we start thinking about the mobilization. We get the chiropractors involved, making sure the neck, the arm is moving, the elbow's moving, and making sure that whole connection through that whole limb is really doing its thing. Now we put the whole team in there, right? So we get assessments, we get the chiropractors, we get physical therapy, we get our exercise strengthening, we get the recurrence of way to try to keep it under control. Think about things that are just kind of regain the strength and produce better range of motion. We need to actually restore movement and then get strength back to keep it under control.
And I think that's the key. And from a chiropractor's standpoint, sometimes those patients are coming in super acute, and the last thing they want to do is have somebody messing around with their shoulder or the elbow. But I think it's important to show how gentle that chiropractic adjusting technique is. So we're going to show a quick clip with Dr. Sherman demonstrating how easy it is to adjust the elbow in the shoulder. Take it away, Dr. Dave.
Hi, Dr. Dave Sherman.
So Dr. Sherman's going to demonstrate today a simple adjustment on the elbow and on the shoulder. And like we always say to our patients too, the chiropractor's role in the practice is to make sure we're getting those joints moving. And sometimes if the patient's in a lot of pain, the last thing they want to do is have somebody, tugging around on a particular joint that's flared. But as you'll see in a moment, it's really a gentle procedure and really helps to kind of loosen up the joint, break up some of that scar tissue. Piece of the puzzle. The chiropractor's role in the practice, as we all know, is super important.
Yeah, very gentle. We'll just demonstrate a couple real easy ones. Why don't we start on the elbow? There's actually two different bones here. So if I come in, this is the radius, the first one here. And I'm just looking for restriction. I just feel it out a little bit, little restriction there. It's very subtle, just like that, very gentle on that one. And then the other bone on the bottom here, the ulnar coming here, and I just feel the range there as well. There's a little bit of restriction, very light, just like that. Real simple and easy.
Absolutely.
Straightforward, comfortable.
Yeah, and I think with the extremities too, we'll notice it's more of a repetitive mobilization versus that one quick adjustment that patients oftentimes, match up with their spinal adjusting too.
Right, and good point. Not many people know chiropractic's not just the spine. It's whole body.
It's every joint that moves.
Yeah.
So the shoulder's a really good one because, as you know, my history with shoulder pain and discomfort back from my UMass days playing tennis is a big issue, and you've always done a really good job of getting that joint moving for me.
Yeah, and again, very gentle, very light. Let's demonstrate that too.
Cool.
How about if you face up here?
Okay, just like this?
Maybe you're heading over this direction. Let's see if we can come in. So, same thing on the shoulder, gonna go very easy. If there's a little restriction here, I'm just using my thigh to distract it a little bit out, and then gentle, just straight through, just to help mobilize, open up that joint just a little bit more from the fixation or restriction that may be in there. Very gentle, very low force again. How's that feel?
Oh, that felt great, and no discomfort, a nice little stretch into the joint too, and again, really just helps to keep that joint moving. And then all the other services that we have to offer will certainly complement too. So well done, and my shoulder's feeling good, as well as my elbow.
Awesome, back to tennis.
All right, you bet. Well, that was fantastic. So we get to see how easy, from a chiropractic perspective, is once you have that accurate diagnosis of what's going on. But chiropractic treatment is just a piece of the puzzle. It's an important piece of the puzzle, but we have so many additional service options that we have in the practice. And what I like What you said is, the use of class 4 laser to help decrease that pain and inflammation, utilizing those intramuscular trigger point injections to help break up those chronically tight muscles. And we always emphasize that we use more holistic alternatives. So no side effects with the class 4 laser. We use a natural product with our trigger point injections called Sherman, so it's plant-based instead of cortisone, because we know how dangerous cortisone can be in terms of destroying the tissue. But there are other options too. We do some regenerative medicine injections as well.
Very much. And think about it, as you mentioned, the cortisone reducing inflammation. Well, yeah, that might be effective really quickly, but again, because of that destructive process, we don't want to get in an acute injury and cause more harm.
Right.
So we have things that we do what's called PRP, or platelet-rich plasma. We take out the person's own blood product, spin it down to the plasma level, and that can be injected as a true regenerative injection. It stimulates the body's ability to repair. It gets the inflammation down, but also helps to heal those tissues that are breaking down and having troubles. So we're getting inflammation down, we're using the laser, we get our PRP, or even a stem cell, again, aspects of a Wharton's jelly injection.
Right.
If there's really some damage to the tissue, maybe after we got an MRI because things weren't settling down over time, you really need some additional reparative properties. And put that all together, you really can actually recover for the longer term, not just an acute fix.
Yeah, especially those regenerative injections. If you're getting older and you're not getting the repair, as you age, you lose that regenerative ability. We can supplement those regenerative cells with those Wharton jelly allograft injections. Again, completely safe. Why would we want to break down tissue where we can use an option to actually help repair the damage to the tissue? If you know of somebody that is suffering with shoulder or elbow pain, please give them our practice information. We can easily be found on the web at maragalmedical.com. There they can find all of the additional services, and the best thing about it, we take most insurances. And don't forget, folks, we're actually extending our fall risk program. We're using our fancy robotics, Hanova technology, to do free fall risk assessments for the public. The screen takes about 20 minutes, and additional information can be found on the link below. So that's it for today. My name's Dr. Timothy Gallagher.
Dr. Michael Marciello.
Have a great day, everyone. We'll talk to you soon.